So it can cost you an arm and a leg to stay healthy in South Africa. Reports a few years ago that we are paying more than many developed world countries for medical procedures caused alarm. Last year, the Competition Commission finally launched its probe into the high cost of private healthcare. Findings are due out in November. The concern is that a lack of competition is making private healthcare increasingly unaffordable, while the public healthcare sector faces major challenges. Well, trends in healthcare costs were discussed at the Discovery Health Medicine Summit today. Dumani Kula is an executive at Discovery Health and he joins us in studio now. Great to have you with us, Dumani.
Thank you.
So what are the trends? Are things getting better or worse?
Francis, once again, good evening to you and good evening to the SAB viewers. The whole global healthcare system is really facing a huge challenge in terms of rising healthcare costs. And in South Africa in particular, we are having that problem, no doubt. And there is an ongoing balancing act really between the cost of healthcare, the quality of healthcare, and the access, to healthcare. And to really kind of achieve that balance is a very tricky balance. As a funder, and I think many funders in South Africa and across the world, they're struggling with that. And I think that's the reality. Is
there any difference between medicine, then hospital stays, then from the reports I read a few years ago, the real concern was the sort of high-tech medical procedures? Those really get you because of the imported technology, or do we also have huge challenges with just medicine?
Yeah, so we keep an eye on everything. Every rand that we spend on healthcare is very important to us. And certainly in our data, in our environment, we find a big chunk of the costs that we pay, they go towards hospital care. And it is largely a function of how our healthcare system is really structured. It is a hospice-centric system. But there's certainly a substantial amount of money that we spend on drugs as well. So in our world, we spend about 7 billion rands on drugs, and it is growing very fast.
Because as I understood it, there was this patent cliff. So pharmaceutical companies themselves are worried that they'll lose out because all the patents are expiring. Aren't we seeing a lot of expirations where you can go and get the generic drugs?
Sure. So we're seeing that. That has given us a huge relief, to a certain extent. And one of the issues that we were discussing today really is how the market, and that, we're talking about pharmaceutical manufacturers, the retail pharmacies, the doctors out there, all providers in the system, really, we've worked very hard as a system to get our use of generics in the market substantially higher than before. So it's moved in our world from about 40% to upper 70s. So that in itself is a success story, that we're having more generics being used. But I think the challenge where it's coming from is that whilst generics are coming in for the older products, there are new products that are being introduced pretty much every week.
And everyone wants the new product.
Yeah, so it's really the new products that are really a cause of pain, where we are sitting today. And I mean, just to give you a sense, so a few years ago, say 8 to 10 years ago, we were spending on a bunch of products, we're spending under 100 million rands, on those products, and what we call novelty drugs or high-cost drugs. So today, that bucket of drugs, we're spending just over 1 billion rands. In fact, for 2015, we're projecting about 1.3 billion rands.
Wow.
When we fast forward
what are novelty drugs?
So these are really the biologic drugs that are coming out, all the latest oncology drugs that are coming out. So these are the kind of drugs where the traditional cost, of treatment, say, there's one drug that was recently introduced in South Africa. The cost of treating that particular condition was on average about 30 to 40,000 rands. With the introduction of that, just one drug, the cost has gone up to 1.3 million rands.
Sure.
Per person.
But people getting much better care, and you do cover that. Yeah,
so I think that's the key, and that's why I was saying, Ella, so really is the balance between the cost of the healthcare and providing access to that and making sure that we're getting the right quality of healthcare. And the challenge a lot of the times with these drugs is that, for example, with this particular drug that I was referring to, only about 25% of the patients, they actually benefit from it. But you have to pray for the whole population, that suffers from that condition. And so the exposure is quite huge. And what we're working very hard at, together with the pharmaceutical manufacturers, is how do we provide access to those drugs in a way that is sustainable to the healthcare system.
Let's look at hospital costs, because you raised those as well. And can we say that customers, patients, me and you as Discovery are on the same side, because we all want to pay less. You want to pay less so you can cover more for your members. Is that correct? What is going on? Because you gave submissions to this Competition Commission inquiry that's underway. Are these hospitals too big? Are they an oligopoly? Are they colluding?
Yeah, so I think for me, one of the things that we really emphasize in the submission that we made to the Competition Commission is that really what the bigger challenge that we have is not necessarily the price of healthcare, you know, the unit price, so the cost of going into a ward or a theatre. That's not really what we're battling with. What we're battling with really is the rate at which all of the different services and products out there in the healthcare market are being used. So, for example, you know, to pay 20,000 rands for a tonsillectomy is not really a big problem. But if you have 10 more tonsillectomies in the subsequent year, that is really the challenge that we are dealing with. And it's really, how do we make sure...
What do you mean, overcare, unnecessary procedures?
So, I mean, it's difficult to say...
Because you are a doctor. Yeah. Who's to blame? Are these doctors? Are these the hospital groups?
So it's difficult, you know, to gauge, because you got to benchmark against something, you know. And in fact, what we do at Discovery, what we do, and I think we do this quite well, is that we are able to benchmark within our system, you know, to say, who are the doctors and who are the hospitals, you know, that are driving, you know, that particular, you know, trend. And I think what we really see is that overall there's usually, you know, 5 to 10% of providers that we have to worry about and talk to and find out what are the issues. And I think many instances we do make headway when we, you know, isolate the problems.
I'm going to challenge you. Does Discovery care enough? Because Discovery is so big now, we know. And you protect yourself. So you say we'll pay so much for that procedure, then the burden goes to the patient. There's even the gap, you know, if a certain patient is spending too much. You have this huge bargaining power with the hospitals, but do you really push them? Because of that bargaining power, you can remain relatively competitive. Do you have to go all the way and really fight in our corner?
So Francis, I mean, I can say this with a very clean conscience, because I'm actually involved in those discussions. I'm at the front line in a way, and we cannot be more rigorous, and, you know, at least in the past. And the negotiations we've been having with the providers out there, in fact, every year they've been getting better for the medical scheme and the consumers. And there's a lot more work that we need to do. And, you know, for 2015, we've had fantastic results in terms of how we've negotiated, you know, those prices. So we're making headway, but there's certainly a lot more, you know, that we need to do. So it's you know, what we're really struggling to do is really, how do we actually control the rate at which, you know, all the different services are being used, as opposed to just price. And that, we think, you know, it should be, you know, quite a key focus in terms of the Competition Commission's work as well.
On the other hand, there's a concern, the Health Minister has said that doctors are already under pressure because of the claims as soon as they do anything wrong. And we're looking at capping fees, maybe for specialists. We don't want it to be a disincentive to people becoming doctors. Then we have a bigger problem.
Sure.
Do you think that is a worry?
Yeah, so I think what really will be more useful for all of us is that, you know, we should not be pointing fingers at any particular group of, you know, of providers. And you know, we think at the end of the day, really, the person in the center of all of this is the consumer, the patient, and our members. And you asked a question earlier, do we care? We absolutely care. You know, our business is driven by making sure that we can provide the best quality of healthcare for our members. And we work, you know, tirelessly with all providers out there to make sure that we can do so.
One final question. Radical transparency. A lot of people are calling for that. So you can see, you know, what procedures should cost, what the doctor's visit to a certain specialist should cost. I think that was kicked out a few years ago, concerns about that. On the other hand, your job is to keep medical aid, medical costs down, to be a member. Are you doing that, and are you being radically transparent in your fees as well?
So you will know, I mean, we attempted this a few years ago. There were legitimate concerns. We pulled back, but we haven't stopped working. We've been working over the last 5 years to see how best we can do that. And I think we've made good progress. You know, over the next few months, we should be getting, you know, more of that type of work out there in the market so that we can empower consumers.
Some sort of database.
Our business is really centered around empowering consumers, empowering our members, and certainly we are committed to do that. So watch the space.
All right, thank you for joining us. That was Dumani Kula from Discovery Health.